Hello everyone, this episode is about bacterial vaginosis. Bacterial vaginosis is really common, very common. In fact, 50% of most bacterial vaginosis is diagnosed in people with no symptoms whatsoever. This is how common it is. And I see bacterial vaginosis 4 times a day at least in my clinic. They're coming for other reasons, and so it is really common. So don't get freaked out if you're getting a discharge. It's really common. So what is it? Well, anyone can get bacterial vaginosis. Okay, you don't have to actually be sexually active, although the more sexually active you are, the more likely you are to be at risk of bacterial vaginosis. But that's not a reason not to have sex. That's just a reason to understand what bacterial vaginosis is. In the vagina you get lactobacilli, and after puberty women tend to collect lactobacilli naturally, and this allows for a healthy environment for the vagina. It drops the pH of the vagina to keep out other bad bacteria, and it's generally a healthy thing to do. Occasionally, through bad habits like using soap or douching, you can lose these lactobacilli. And that can cause bacteria that are already in the vagina to overgrow. And so so when I say bad bacteria, you've got bad bacteria in your vagina all the time, and you have good bacteria in the vagina all the time, but usually the good outperform the bad. But when the bad outperform the good, that's when you get the discharge, and that's when it gets a little bit too much. And so what do you do? So you can treat it at home, but if you're having trouble, you can always phone up your local sexual health centre, your family planning clinic, or your sexual health clinic, otherwise known as a gum clinic. It all depends where you are in the world. These clinics would be called different things. You can also see your family doctor. At the end of the day, someone needs to look at a sample of your discharge, ideally under a microscope, and they can get you the diagnosis there and then of what bacterial vaginosis is. The treatment is fairly simple. For bacterial vaginosis, it is usually metronidazole, but you can also use clindamycin. They're just antibiotics, usually for 5, sometimes for 7 days. And then after you use the antibiotics, you should use probiotics either intravaginally or orally as a tablet. And this repopulates the vagina with good bacteria and then stops bad bacteria coming back. Recurrent bacterial vaginosis is a thing, and I would suggest you watch the video regarding 17 ways to prevent bacterial vaginosis. So apart from that, have good sexual health, and have a sexual health screen if you need it. And if you're worried about bacterial vaginosis, get it sorted. Take care.